Hi, this is Sue Watkins with the Institute for Tribal Environmental Professionals at Northern Arizona University. Thank you for joining the webinar. This webinar series is introducing the Local Environmental Observer Network, discussing extreme weather events, and discussing the impacts of climate change on human health and on fish and wildlife. Okay. Today's webinar is focusing on the impacts of climate change on tribal health. We have two more webinars in this series. The next one will be on Friday, June 26th, focusing on extreme weather events and climate change. And then the last one of the series is on June 29th, which is next Monday, and it will be focusing on climate change impacts on fish and wildlife. This webinar is being recorded, and we will post the presentations and the webinar recording on ITEP's Climate Change Webinars webpage. The link to the webpage is on the announcement about the webinar series that we sent out, and I also put it in the chat box on which you should be able to find on your screen on the right-hand side. If you have questions during the presentations, you can type your questions into the question box. Again, look on the right side of your screen to find the question box. And after the two presentations, the presenters will answer your questions. And then following the webinar, you'll receive a link to a short online evaluation form. Please take a few minutes to provide feedback and suggestions of topics for future webinars. This is really useful for us when we are planning webinars in the coming year. Okay, next. Here is my contact information. ITEP's climate change program offers climate change trainings, webinars, a tribal climate change newsletter, and the Tribes and Climate Change website, and much more. Please visit our program website at the URL listed on the slide, and please feel free to contact me if you have any questions about ITEP. I'm very pleased to introduce our first presenter, and while I'm doing that, Natasha, please switch over the screen to Leslie. Our first presenter is Leslie Jantarosamy. Leslie works in the Climate Change Division of the U.S. EPA's Office of Air and Radiation, where she serves as the division's tribal and environmental justice contact. Her work focuses on the intersection of science and policy to better understand the impacts and risks to human health and the environment from climate change, as well as projects supporting adaptation planning in tribal communities. With that, Leslie, why don't you take it from here?
All right, thanks, Sue. And my slides are visible to everyone?
Yes.
Okay, great.
At least to me.
Right. So I'm going to start out actually by talking about the U.S. Global Change Research Program and their efforts looking at climate change and human health. So EPA is actually just one of a number of federal agencies that are involved. About 13 federal agencies participate in this interagency program looking at building a knowledge base to inform human responses to climate and global change. And so really the goal of the U.S. Global Change Research Program is to produce information like we're talking about today on what are the impacts of climate change on various topics. And so today's focus on human health really comes about because, sorry, I'm going to minimize this. Polls of the American public have really shown that few Americans are aware that climate change has a health impact or has implications for our health in this country. And so I think folks in the public health community, like in the academic community or like the director of the World Health Organization, they've been speaking about climate change as a public health issue in recent times, but it really hasn't become something that most people on the street are aware of. And so the U.S. Global Change Research Program is aiming to provide a comprehensive assessment of the impacts of climate change on human health in the United States, to really get the information into the hands of the public, into the hands of scientists and policymakers, and really try to increase awareness about the health relationship of climate change to human health. So the motivation for doing this report and this assessment of existing science on climate change and health is in part motivated by the President's Climate Action Plan, which actually just yesterday, it's the 2-year anniversary of that plan. And so the White House did a big event talking about climate change and public health issues just yesterday. And so this is great timing for this webinar, actually. So the President indicated that we need more information. We need more definitive, we need more quantitative where possible information about what does the future look like for climate and health. And so this assessment and this report that will be coming out, the purpose of it is to provide this assessment of observed and projected climate change related health impacts, drawing from the existing science. So really providing a state of the science, what we know today. And so the audience for the report is focused at multiple different levels: policymakers, decision makers, community health kinds of organizations, national health associations, really anyone who has an interest in these topics. We're hope to shine a spotlight really on this issue and get more people talking about it and trying to provide sort of that baseline science information to inform decision making and action. And so speaking of that, I just wanted to draw your attention quickly. This is a little bit of a separate topic, but there are other federal climate and health initiatives that are either starting or ongoing and trying to develop resources for state, local, and tribal governments, as well as other organizations, to provide climate change data. So the Climate Change Data Initiative, information on resilience and adaptation, really trying to provide real-world tools and resources and expertise to help people think about climate change risk and improving resiliency and preparing for the changes to come. And then a third initiative that's ongoing is the Sustainable sort of Healthcare Initiative, and that's really looking at hospital infrastructure and healthcare infrastructure in the country. So these are the types of sort of initiative efforts that that can really benefit from having more quantitative information and projections of what the future will hold in terms of climate change and health, so that we can then plan for it. So who is involved in our efforts? So there's a ton of acronyms here, so let me just break this down a little bit for you. The Climate Change and Health Assessment is a product of the USGCRP, which is the U.S. Global Change Research Program that I just spoke about. It's a part of the National Climate Assessment. So this is a picture here on the slide of the National Climate Assessment that came out in 2014, about this time last year, actually. And you may have heard we had webinars, at that time on the third National Climate Assessment, because there is a specific chapter devoted to Indigenous peoples, lands, and resources. And I'm going to speak a little bit more about the findings of that chapter later on in the webinar. And in addition, that climate assessment had a chapter on human health. But it was just 8 pages, because the National Climate Assessment covers a breadth of topics about impacts to infrastructure and water resources, forestry, agriculture. So it covers a lot of different things, and human health was just one component. And we really felt that health needed a more in-depth look. And we needed to have more space to really get into some of the details of health and expected health impacts. So the Climate Change and Human Health Working Group of the USG-CRP, this next acronym, is driven by the CHIG, we affectionately call that acronym. The Climate Change and Interagency Working Group here felt that it was really time to have a separate report devoted to the topic of health and going for more of a deeper dive into the issue than what we were able to do in the National Climate Assessment. So EPA is playing a coordinating role, but really this is a very government-wide. There's a lot of participation from the agencies that are part of the Department of Health and Human Services, HHS, so the National Institutes of Health, the Center for Disease Control and Prevention, Occupational Health, NIOSH, the FDA, et cetera. You see here, NOAA is playing a huge role, EPA, USDA, Department of Agriculture, NASA, USGS, and even the DoD has contributed pieces to our draft report. Just to give you a flavor of what topics are covered in the report, we're covering about 9 different things, or 8 if you don't count the introduction chapter. And these are also covered in the National Climate Assessment, but we're really, like I said, going more in depth and pulling out quantitative information where it's possible and really pushing the envelope in terms of trying to model what's going to happen or what we expect or project to happen in the future. What the report does not cover is anything related to mitigation, so reducing greenhouse gases or strategies to reduce our emissions. It doesn't cover adaptation in the sense of how do we then prepare for the health impacts of climate change, and it does not attempt to put a price tag or an economic valuation onto any of the impacts that are quantified here. So we're really just focusing. This is sort of the first time we've had this push to quantify and model future projections. So we're really just aiming to make this a very scientific document and trying to understand where the current state of the science is, and then the next step could be to inform adaptation and other types of decision making. But this report will not go there. It also does not provide policy recommendations. It does not really cover comprehensively an assessment of research needs. It will cover just a very short section at the end of each chapter. We'll sort of discuss where are the major gaps, but that would require a whole different effort to be a really true comprehensive assessment of research needs. And then we're also not able at this point to cover a lot of sort of compounding or secondary or cumulative health effects because, again, sort of the state of the science really isn't there yet, and this is really the first cut at being able to quantify some of these impacts. So what the report does, though, it strengthens and expands our understanding of health impacts. So we're updating the findings that have been previously reported in other venues. So there was a 2008 assessment of interagency. Federal government put together a report on health, but it was very qualitative, and a lot of times, it said we think, we expect maybe that, these types of things might happen, but it wasn't able to be as definitive as we are now. So we have stronger evidence, we have new analyses. The scope is broader now, so those 9 topic areas that I showed earlier, that's sort of an expanded version of issues that haven't been covered in depth in other reports. And we're really going to identify risks and vulnerabilities to specific populations as well. We're calling this an interim report because the idea is to publish it between the 3rd and the 4th National Climate Assessments. And our current plan for release is next spring. So after we've responded to public comments, the public comment period actually just ended earlier this month. It's out for a 60-day review. We have peer review comments coming from the National Research Council of the National Academy of Sciences, and then we'll go through an interagency process. So after all of that, we'll have a document in spring of next year that we can come back to you guys and talk more about the findings of that report. But in the meantime, so while we wait, for this report, what do we already know about climate change health impacts? And so some of the places that we like to draw from when talking about this issue are the definitive works, the efforts that look across the scientific literature to draw broad conclusions. And these are all peer-reviewed studies, very highly reputable, great sources of information. So, like I said, the third National Climate Assessment, and providing web links here for you if you want to look at the reports. A lot of them, have very broad focuses, other than just health, but generally there's a health chapter if you want to focus in on that. In the case of the third NCA, there's actually, the tribal chapter, the Indigenous Peoples chapter that you can download. And the National Academies of Sciences produced a preliminary look at the indoor environment. So if you're interested in indoor air issues and climate change, that is a good document to look at. So I'm going to go through just at a very briefly, kind of high-level overview of some of the major themes that come out of these reports when we sort of survey these what we already know about climate change health impacts. What are the main concerns that come up in these reports? So the first, and these categories actually come directly from the National Climate Assessment. These might look familiar to you. Air pollution and allergens. So changing climate, we're talking about the rise in global average temperatures. We're talking about changes in precipitation. All of these changes affect the air we breathe, both indoors and outdoors. So climate change is projected to affect human health by increasing ground level ozone and, in some locations, particulate matter. And this also relates to the effects of climate change on wildfire, and the increasing frequency and intensity of wildfires in some regions of the country contributes to emissions of particulates, which have a human health effect. I think probably a lot of you are very aware of the human health effects of climate change. It's been very well studied. It's something that EPA obviously does a lot of work on because of our standards that we set for reducing air pollution. So ozone, particulate matter have a lot of both cardiopulmonary kinds of effects on illness and disease rates, can contribute to premature deaths and exacerbation of asthma and different respiratory illnesses. And then I wanted to touch briefly on allergens, something that my colleague in the next presentation will speak about a little bit, but increasing CO2, so carbon dioxide in the air, promotes the growth of plants. And some of these plants that produce allergens, or pollen, different things, you'll see an increase in airborne allergens, which can also exacerbate respiratory illnesses like asthma. Moving on, temperature extremes is the next big theme that we see for health impacts. And it's sort of self-explanatory, right? As global average temperatures increase, we can expect to see more extreme summer heat here in the United States. And there are trends that have already been observed about increasing temperatures in our different regions all across the country. It's projected to become more frequent, more intense in the coming decades. So we'll see these extreme heat events more often. And so a lot of people say, okay, well, it's warming, so we'll probably have a reduction in extreme cold events. And so yes, deaths and injuries related to extreme cold are projected to decline, but it is not expected to offset the increase in heat-related deaths. So the effects of heat are going to outweigh the effects of reductions in cold impacts. Next category is precipitation-related extremes. So climate change has been projected to increase heavy rainfall, which leads, and contributes to flooding in certain areas. increasing frequency of heavy rainfall in certain regions, and also coastal storms can contribute to coastal flooding. So lots of different flooding types and different risks in different regions, but as on the whole, we can say that there are projected to be increases in flooding. Also in drought in certain regions, particularly the Southwest United States, will see less precipitation, so the other extreme, and so this will increase people's exposure to a broad set of health-related hazards. So flood hazards can include drowning injury, increasing risk of contracting waterborne diseases, and also indoor air quality problems. If water gets into buildings, residences, it can contribute to dampness, potential mold growth, that sort of thing. Drought-related health hazards include contributions to conditions that create wildfires. They can exacerbate dust storms, which have respiratory illnesses, and particulates are related to dust storms. Extreme heat events, flash flooding, degraded water quality, and reduced water quantity from drought. So food and waterborne diarrheal disease is another category mentioned in the National Climate Assessment. However, they do note that in this country, in the United States, we generally have safeguards in place. We have a food system that, standards in place, and water treatment plants in most parts of the country that can accommodate some, changes in precipitation and in flooding that can, treat our water and our food to safeguard health. However, these climate-related factors, so air and water temperatures, precipitation, extreme rainfall, can sometimes overwhelm the systems that we have in place. So this cartoon or diagram graphic here shows different pathways for how climate-related factors can increase a risk or exposure of disease. So heavy rainfall, for example, can cause sewage overflows from treatment plants or septic fields. Municipal lines can back up. You can get, human waste entering into our surface waters, which then, can contribute to a risk of exposure to pathogens carried in that sewage. So that's just one example. You can see some others here in the graphic. Diseases carried by vectors. So climate is one factor that influences where we see vectors. And by vectors, I mean insects like fleas, ticks, mosquitoes, that spread pathogens that cause illness. So the types of diseases that are currently found in North America include Lyme disease, dengue fever, West Nile virus, Rocky Mountain spotted fever, plague, and tularemia. And so climate change does influence the distribution of these types of diseases, and then so in the future, if we see any shifts or expansions in the geographic ranges of vectors, so where the temperatures are conducive or helpful for these vectors to spread into and occupy a new habitat, that could potentially affect where we see these types of diseases occur. Food security is the next theme for health impact, and again, the National Climate Assessment sort of stresses that the U.S. is in this particular topic probably going to be less affected than many other countries, given the relative how good our infrastructure is in certain ways in terms of safeguarding our food security and our agricultural and food system. However, particularly relevant, for indigenous people that have subsistence lifestyles, and particular dietary patterns, such as Alaska Native, for example, will face shortages of key foods. And we'll talk a little bit more about this when I go over the indigenous peoples chapter. But the people that grow their own foods or rely on traditional harvesting of traditional species will be affected. Food insecurity can increase with rising food prices, so to the extent that rising temperatures or extreme or different changes in precipitation affect our ability to grow crops. We could have effects to food prices. Another way that climate change could affect food security is that the nutritional value of some food crops is projected to decline. This includes things like wheat. So farmers are also expected to need to use more herbicides and pesticides, which could increase chemical exposure risk for those who work in that industry and potentially for consumers as well. The next category is mental health stress-related disorders, and this primarily relates to extreme weather events. And I know you're going to have another webinar about that, so but the health implications related to extreme weather and mental health include high levels of anxiety and post-traumatic stress disorder among people that were affected by Hurricane Katrina, and so some similar observations have been made following floods, heat waves, and wildfires. In children, primarily because of their physiological and developmental status of their lives, they're especially vulnerable to trauma resulting from extreme weather. In addition, patients with mental illness and some that take certain medications for their conditions are actually especially susceptible to heat. Certain medications actually hinder people's ability to keep cool, so it interferes with their body's normal capacity to cool itself, and so they are more susceptible to heat illnesses. And then finally, there's a strong theme running through the National Climate Assessment that says that these risks and potential exposures are not going to be equally distributed. So the most vulnerable among us are at most risk. So people that that face existing health threats, people that already face issues related to health, climate change is just adding on top of that. It's another stressor. It's another threat that will exacerbate health impacts. And certain people and communities are especially vulnerable. These include children, the elderly, the already sick, the poor, and some communities of color. And then increasing number of Americans who are obese or have diabetes, heart disease, or asthma. These types of conditions make them more vulnerable to a range of health impacts from related to climate change. And the poor are less able to afford the kinds of measures that can protect them from and treat them for various health impacts. So now I just wanted to finish with an overview of the major health themes that came out of the Indigenous Peoples, Lands, and Resources chapter of the National Climate Assessment. They identified about 5 health-related themes that affect Indigenous peoples, and they have a lot of very specific examples from different regions. So I definitely encourage you to go and download that chapter, take a look for some of the more specific information. But just a high-level overview is that food safety and security is projected to be a big issue in Indian country, given that medicinal and food plants are already becoming harder to find or are no longer found in historical ranges. So the projected impacts of climate change will affect Indigenous people's ability to harvest some of these or cultivate some of the plants that are very important both nutritionally and culturally. So for example, berries in the Northeast, wild rice in the Great Lakes have been affected by warming winters and changing water levels. For tribes engaged in hunting and fishing, the changing or shifting ranges of species or changes and declines in the health of certain species. So for example, moose populations in the north, these will affect traditional hunting and fishing, and specifically called out in the chapter are changing travel conditions for Alaska Natives who hunt on sea ice and the changing, more dangerous conditions of declining sea ice for some of the hunting in Alaska. And then in terms of food safety, an example identified in the chapter relates to, and I have a picture of this here, thawing ice cellars in Alaska was a traditional way of storing foods could be at risk from warming temperatures and thawing permafrost, which create conditions that create more food spoilage, and so health impacts health is at risk from the ability to safely store food. And then water quantity is a theme that runs through the chapter, sort of could be summed up by it's either too much or too little. So in certain regions like the Southwest, we're looking at drought, we're looking at declines in snowfall and snowpack in the West. So they're not getting enough water to sustain sort of the surface water that used to be there. And then in other cases, or when the rains do come, they come, in very heavy bursts, and so you can get, increasing flooding, increasing intensity of rainfall and storm events. And then in places in Hawaii in the Pacific, they have monsoon seasons, and so they've seen a shortening of that rainy season. This also relates to water quality and degraded water infrastructure. So in some cases, in certain reservations, water infrastructure is already in disrepair or already lacking. And so climate change on top of that can further damage or overwhelm some of the water and sewage systems on certain reservations or in certain villages. And so this presents a health threat to drinking water supplies and to public sanitation. These types of effects, particularly many of the food effects, really contribute to loss of cultural identity for a lot of tribes, or potential threats to cultural identity. Impacts to a tribe's land base, to the structures that are there, the natural resources that are available. These are tied to cultural traditions, and these are sort of tied into health in the sense of cultural well-being, and social well-being of the community is very essential, and these types of impacts can also be considered health impacts. And relocation and displacement is, a threat for some, or maybe a future risk, but it's a reality for others. And this is a picture actually of a Alaska woman who is dealing with the idea of or the reality that she may have to relocate, and some people are being displaced from their traditional homelands, and this obviously has implications for health and community health as well. So those are the major themes coming out of the reports that we already have, that we already know about, and then we expect to see even more detail, more information in our forthcoming U.S. Global Change Research Program Climate and Health Assessment. And if you would like to see more information about that forthcoming report, I provided the website here, and please feel free to contact me. My email address is here. And I think that we will be moving on now to the next presentation by my colleague Mike, and we'll do questions, I think, at the end.
Yes, thank you very much, Leslie. Just a reminder, you can type in your questions into the question box. After the next presentation, we'll go through all the questions for both of the presenters. Also, I want to point out, you should be able to see a thing called handouts in the panel on the right-hand side, and we have one handout that you should be able to download. It's a climate change and human health fact sheet that ITEP produced, and it talks about climate change impacts, but also has at least a few things that ideas for what a tribe could do regarding this. Okay, now I'd like to introduce Mike Collian. Mike is an environmental scientist for EPA's Climate Change Division. He currently oversees EPA's Climate Change Indicators effort and is a senior analyst of climate change impacts and policies. Mike has been with the EPA for 15 years, and prior to working on climate change, he managed EPA's National Air Quality and Deposition Monitoring programs. He has an MS-PH from Tulane University's School of Public Health and Tropical Medicine. Okay, with that, Mike, I'll turn it over to you.
All right, thanks a lot. I really appreciate the opportunity to be here and to talk about this project that we have here at EPA, Indicators. And so I will just launch right in, and here I just have some key messages, key themes that I hope resonate, shine through sort of the rest of this presentation. Climate change is happening now, and we have a lot of evidence across a wide range of observations and multiple timescales. Whether you're looking back 1,000 years, 100 years, even just a couple of generations, we see changes happening related to climate. Another really key thing and message here is our lives are connected to climate, and there's a critical need to communicate the relevance of these changes and how they affect human health and society. This is how people understand why this is important, why these things matter, and relate that information to their lives, their community. Today's global warming is unprecedented and is driving a cascade of side effects. Melting ice, higher seas, heavier rain, all things that we are tracking. Last, or thirdly here, indicators are a powerful tool for communicating this science and really understanding the effects of climate. So when we're communicating and understanding and even trying to address issues related to climate, indicators are helpful for transferring that information to the people that need it, the decision makers. And it brings attention to these effects. So that's a little bit about why we do indicators and the usefulness of them. But so this next slide, again, they're a really effective way for communicating this science. It simplifies it. It makes it accessible to a range of audiences that you may be dealing with. It provides that context. We're always interested in patterns of change, the rates of change, the timing, frequency, intensity of certain events. And indicators are a really convenient way to track that, to understand that. And again, we're trying to connect the dots between climate change and our lives and values. Why does this matter to me? So it provides that foundation for informing decisions and further investigation. Very important piece of the communication puzzle. So we're just taking observed data and providing some analysis and coming up with a visual representation or expression of that data. Just to talk real quickly about our report. So EPA has a climate change indicator report where we're summarizing 30 different indicators related to the causes and effects of climate change. All of the indicators are based on observation, so there is no future projections or no modeling that's involved with these indicators, and it sort of makes it a little more manageable and people understand measurements and records and history when you're talking about trends. And for even those that may even distrust models, this provides useful evidence of these changes. There's over 80 figures, maps, and graphics within the report. We collect data and obtain data from 20 federal, non-federal agencies. We have over 40 different data providers that we contact routinely to update these indicators and that are helping us generate these graphics. The science and the indicators themselves are very consistent with the latest climate science, the latest climate assessments, which Leslie was just talking about, the National Climate Assessment's third assessment, both of in the IPCC, the assessment report, fifth assessment report, both of which sort of came out in 2014, right before our report. So we're very consistent with the science there. It's very credible, reliable information. So it's in both a report, I think a little less than 100-page report, and then a really nice website which allows you to navigate through all of the indicators and information as it would appear in the report. So this next slide, sorry, don't try to read everything here. This is sort of our poster slide, and it's really to sort of get at the breadth of information we're talking about here, telling the climate change story from all the way from atmospheric concentrations of greenhouse gases all the way down to leaf and bloom dates and wildfires, things that are happening in the ecosystems and how they're related to climate change. This is only about 50 or 60% of the indicators that we have. It's just, again, for a broad view of all of the things, that the range of observations that we're covering in this report, and where that information fits into these categories. So changes are happening across ecosystems and oceans, weather and climate, health and society, snow and ice, and all of these various chapters. So next, we were just going to introduce some indicators, ones that are very relevant to health, and I think we should consider in the health definition sort of the well-being, society. So we're not only looking at indicators related to health outcomes, but we're also looking at just health-relevant indicators where there may be property loss, damage, other impacts to your community other than traditional health outcome indicators. So we have extreme temperature and precipitation, heat-related deaths, sea level rise, snowpack, wildfires, ragweed pollen season, the incidence of Lyme disease, and then we'll just take a real quick look at changes at regional and local scales, which is really important. People really have a high expectation for information at that level, and that's what's meaningful to most people. So we'll try to just go through, preview a few of these indicators to give you a sense of what we're talking about. In most cases, you often hear about global mean change or average change in temperature, but it's really important also to look at the extremes or unusually hot temperatures which would have health impacts. We have an indicator here from NOAA's NCDC, the Climate Extremes Index, which points to nationwide unusually hot summer days have become more common over the last few decades. And so we're looking at looking at summer months and the highest part of the distribution, the highest 10 percentile of the temperature records. And we're seeing that there are more hot daily highs, which occur, every day has a daily high and a daily low. Daily lows usually occur at night. And both of these metrics are increasing over time in recent decades. of course, this, these unusual temperatures can lead to prolonged extreme weather events, heat waves, winter cold spells, although we don't have a lot of evidence that winter cold spells are increasing over time. Heat waves, as Leslie was mentioning, can lead to illness and death, particularly among older adults, the very young, vulnerable. People can also die from exposure to extreme cold or heat. And so in addition to prolonged exposure to excessive heat and cold can damage crops and injure livestock. So there's a lot of things going on when we're looking at the temperature distribution and these unusual hot summer temperatures. There's a lot of impacts associated with this. And again, just another way to look at temperature that people understand. Here we're looking at the proportion of record highs to record lows. You often hear, oh, we've just set a record high temperature for the other day. We were in triple digits. It's very hot. So what we're seeing over time when you aggregate these data by decade is an almost 2-to-1 ratio of record highs to record lows. So we're seeing a lot warmer temperatures, and they're setting records since the 1970s. So the most recent decade, again, had twice as many record highs as record lows. Another one on the high and low temperatures, in case I haven't pounded this home yet, but we're looking here at a map of these weather stations, and this is useful because there are patterns that emerge, and we're interested in knowing where these temperatures are happening. But just looking at this time period and the 95th percentile, so really the number of days with unusually hot temperatures. And you can see the red triangles is where that's increasing, and the number of days where that's increasing over this time period, and then the blue triangles where that's decreasing. In contrast, if we look at unusually cold temperatures over this same time period, we're seeing almost uniform decreases in the number of days below the 5th percentile, so those really cold days at all of these locations appears to be decreasing. So what is the result of these changes in the temperature and temperature distribution? Well, we have heat-related deaths. CDC has a couple of different metrics for tracking this, and this is a national depiction of heat-related deaths from 1979 to 2010. And so, this usually tracks pretty well with heat-related deaths in heat wave years or excessive heat years. It's not the perfect metric because it's collected from records, medical records, which don't necessarily reflect current temperatures, and so, but it is something that we have to watch, and at local and state levels, this is a very useful metric to be concerned with when we have record heat waves and high temperatures. Heavy precipitation. This is another component to NOAA's Climate Extreme Index, and this is showing over this almost century time period the annual percent of land area receiving intense single-day precipitation events. So we're looking again at high rainfall events for each year across thousands of stations in the U.S., and we see the prevalence of these one-day extreme precipitation events occurring more frequently over time, and in particular over the last couple of decades, several decades. So the potential impacts of heavy precipitation, I think Leslie also covered this too, is you have crop damage, you have soil erosion, you have increase in flood risk due to heavy rains. In addition, runoff from precipitation can impair water quality, and pollutants deposited on land can wash into water bodies, impairing water quality. So you have lots of reasons to be concerned for more heavy precip coming in single-day events. Sea level, another important indicator where we have quite a good data set going back to 1960 here, looking at the U.S. coasts. And this data, too, is coming from NOAA. We have 60 or 70 tide gauges measuring relative sea level. So this is sea level relative to land change. And so along the U.S. coastline between this time period, or for this time period, particularly in the mid-Atlantic and parts of the Gulf, some stations registered more than 8 inches of sea level change. But meanwhile, you can look in places like Alaska or the Pacific Northwest, where sites are seeing a decrease because of land elevation has risen more rapidly than sea level. So, but the majority of sites and a lot of key areas in the U.S. are vulnerable to this sea level rise, and the implications there, a lot of implications to human activities in coastal areas. It inundates low-lying wetlands and drylands, erodes shorelines, contributes to coastal flooding, increases the flow of salt water into estuaries and nearby groundwater aquifers. Higher sea level also makes coastal infrastructure more vulnerable to damage from storms. So a lot of potential impacts from rising sea level. Snowpack. This is a pretty important one. It's been in the news a lot quite recently, especially in California, Washington, and Oregon. We have data here from the last couple of springs, which have been very low snowpack measurement levels. But here, looking at long-term trends from 1955 to 2015, snowpack has declined at 90% of these sites. So it's pretty widespread declines in snowpack. Overall, about a 22% decline. Some areas, of course, are seeing some increases, but in general, we're seeing a lot of decreases. And we know mountain snowpack plays a really important role in the water cycle in the American West. In particular, storing water in the winter when the snow falls and releasing it as runoff in the spring and summer when the snow melts. Millions of people are reliant on the melting of that snowpack for power, irrigation, drinking water. And so when we have losses, these are particularly impactful, as they seem to be this year in particular, with water restrictions and the upcoming fire season, or the fire season that's just started. So there's lots of impacts associated with that. And speaking of wildfires, here's an indicator we have of the total area burned each year from 1984 to 2012, and showing the trend, but also the trend in severity. So there's severity classes here, and we see the range increasing over time. This seems like a relatively short time period, but this is based on consistently collected data as far back as we can go. But it's also pointing to an upward trend in wildfires in the United States. So this is all of the United States, not just the West. Here, just to examine wildfires by state, we have the same information. In the left panel, A is for the full time period, so each state is colored based on the change in burned acres per square mile. And then in the right panel, we have a split of the two time periods to see which states are seeing the greatest increase between those two time periods. Ragweed pollen season. This is something that Leslie also mentioned, and this is a really neat indicator depicting the pollen season, not necessarily the increase in pollen concentrations in the air, although that's likely happening as well. But here we're seeing the length, just from the spring time to the first fall frost is increasing over time, and it gets greater as you move further north. So you look at places in Canada, you're seeing 27, 22 days longer of pollen season. I'm sure people are already waiting for that first fall frost to knock down the pollen, but this is what we're seeing, and this trend is consistent with many other observations showing climate is changing more rapidly as one moves higher in latitude. So obviously these affect allergies. There's a lot of implications with increased pollen concentrations as well as an increased pollen season. And people seem to understand that pretty easily. And then we have Lyme disease. Leslie also talked about vector-borne diseases. This is reported cases of Lyme disease incidence. This is one of the most common vector-borne diseases that we have in the U.S. And you can see that increase over time. As Leslie also pointed out, this is driven by multiple factors, not simply climate alone, but we have strong evidence, the science is fairly strong, that the change in distribution and the expansion of vector-borne diseases will increase with a warming climate. So this change you see in the two maps is driven by multiple factors. More proximity to urban areas to where the deer, which is host of the Lyme tick, might be. There's land development changes. There's reporting better awareness and better reporting of Lyme disease over time. So those factors are built in, but we know this is an important indicator to track and to monitor going forward as we continue as the climate continues to change. This is just a window into what we've done in the report as well. It's dialed into a particular area or a particular region to take a closer look, really examine why these trends matter and what in particular is being impacted. We have temperature and drought in the Southwest, and you can examine those states in particular for drought, because when you look at the national trend for drought, it's not as stark as where it is for the Southwest, and it's because we have regional differences, but this is a way to dial into an important issue, an area that's particularly sensitive to these changes. We also have a couple of perspectives on long-term records, cherry blossom bloom dates in Washington, D.C., something very important to the tourist economy here, and people are interested in tracking, but it is a very long-term record, and is the peak bloom dates changing over time, over this 94 years, and it's something that resonates with people. People understand that, now I understand why we'd be concerned with changes in these, having these effects. So that is a window into those two, and coming soon. So EPA has updated nearly all of its indicators. We're going to be kind of posting those online in a week or two, so all of the indicators will be updated with new data that's become available, some as recent as 2015. We'll have new interactive figures and some GIS ways to explore the data, click on areas where you are, and as always, we have downloadable figures, and we're moving to providing the data as well. We're continuing to assemble new indicators and develop content for a new report in 2016. So we're still adding more and looking for additional ways to improve and capture what's going on. I'd like to mention too, there's an upcoming information webinar to solicit feedback specifically from tribes, as we're interested in getting that feedback and developing content that meets everybody's needs and is particularly relevant to tribal communities. And so if you're not already aware of that, we can maybe get that information more specifically to you guys after this. And if you want free copies of the report or other materials, give us a shout at this address and go check us out online. And with that, I think I'll wrap up, and we're totally happy to answer questions and take it from here.
Thank you, Mike and Leslie. We have received some questions, and those of you who haven't typed in your questions yet, please type them into the question box. We'll go through the things that people have entered in there. So one question is, will you look into climate refugee impacts with population pressures going into other areas?
That is a really good question. I assume that it's directed to me or to the U.S. Global Change Research Program's Climate Change and Health Assessment.
I think so. It was typed in while you were giving your presentation.
Okay. You know, I think the issue of refugees and migration is one that has not been very well studied to date. I think people are starting to think about it, but the Climate Change and Health Assessment pulls from existing published peer-reviewed scientific literature. So if it's not well studied already and what's out there in the published literature, we can't really talk about it in the report. So that could be an area where we just have to say it's a gap. We know it's a gap. It's an emerging issue, and we are concerned about it, but we may not have much information to really draw robust conclusions about the potential impacts for refugees or migration resulting from climate change impacts. But that's a really good question.
Okay, the next question, the development of indicators for adaptation and resilience is an emerging topic in the field. Do you have any lessons learned from the EPA climate change indicators that could be applied to the development of the new suite of indicators?
Yeah, and it's a really good direction to head, and I think we're interested in going to that area too. And just, you know, so the indicators that I was just showing are mainly detection type indicators or climatic indicators where we're detecting signs of climate change. But there's also the side, well, we have to be aware of the vulnerabilities and be tracking these vulnerabilities and seeing if there's increased risk. Where that we're adapting, we should be tracking if we're doing a good job at doing that. But that's a definite great areas to head into. The criteria that we use for our indicator are fairly specific, and that's sort of why we've ended up with the ones that we've ended up with, and haven't really crossed that line into adaptation and even mitigation type indicators, or those forward-leaning type indicators. so I think as long as you're setting out with a fairly clear set of criteria and what it is you're after, I think you can develop your indicators from there and include those things that are important to you. But I think what we probably have to do is start a new line of indicators, and I think that's not out of the question, and I think that's where we should be heading.
Okay, thank you. And then this next question, it's pretty long, but it's also about indicators. What specific examples and indicators of climate change impacts on the health of tribal populations do we have? Much of the discussion thus far has been pretty general and abstract. I'm interested in more specific information on where, how, and how much tribal populations are being affected. If the data are not available, then perhaps the question is about what studies are underway and when can we expect results. Have we begun, for example, to pin down how and how much more tribal populations are exposed in different ways than other population segments, or less, which would be great. I'm especially interested in the results of ongoing work in the lower 48 states. Thank you.
Yeah, just to start, I'm going to have Leslie probably answer this too if she wants, but I felt bad at first for having so many lower 48 indicators in there, but we are trying to make a call for that information that's more specific at the community level, at those local scales that are fairly specific to the vulnerabilities of tribes, and that's part of the intent of that upcoming webinar on July 2nd, is to kind of seek that feedback and get that information. But all of these indicators, many of them were national, but if you do scale them, they would apply to tribes just as much as they would apply to others. And I think one of the important things is to get the information at that level as much as we can, because those effects are likely to affect everybody, regardless of where you are. And so I guess I can maybe see if Leslie...
Yeah, I think the part of the question that had to do with changing exposure risk and can we quantify that, I think is very relevant to what we're trying to do in the climate change and health assessment as well. But as you noted, it's an area where people, again, have not really been able to quantify it to date. I think the chapter that goes into risk factors and populations of concern, there will be a section on Indigenous peoples' specific risk factors, and so what are the things that contribute to the vulnerability, the health, related vulnerability of tribal peoples in the United States. And so, but what I've been seeing thus far in the draft is, unfortunately, a little bit more qualitative. Just given the nature of the research to date, we've been able to discuss, the factors that contribute to the vulnerability, but not necessarily quantifying or modeling future projections of health outcomes for specific populations.
Okay, the next two are actually comments from a person. Ticks in the it's about this first comment is about ticks in the Columbia River Gorge drainage. In Washington and Oregon, there's been a reported increase in ticks in cases of Lyme disease occurrence. And his next comment is the Columbia River is quite low this time of year, and predators to the salmon have increased. These predators are sea lions and cranes. Eradication of these predators have been proposed by those that support salmon fish protection. So those were comments. And then the next one is a question. This is just a general question. First off, thank you for the webinar. I learned a lot and there's plenty of good information. Coming from rural Alaska, I wanted to know what would be the best way for me to utilize what I learned from this webinar. I'm having a hard time thinking of ways I could apply this to the ways I could apply this to my work and where I live. We are working under the EPA IGAP program, and we have concerns with climate change. Where can we start planning and preparing for addressing issues related to climate change? Can we contribute in any way? Where do we fit in with all this? What can we do?
So many good questions wrapped up in there. I think I'll take a stab at answering just based on, you might want to take a look actually at the what Can Tribes Do section of Sue's handout that she has posted in the handout section of the webinar. It talks about the ability to take action and also to point you in the right direction for resources for adaptation planning. So if that's some of the work that you're interested in pursuing under the IGAP program, adaptation planning, Sue and ITEP have great resources for getting started in thinking about climate change and its effects in your community. And the types of information and data and the indicators project, as well as the health assessment work and the national climate assessment, that's the kind of science and the kind of information that feeds into adaptation planning. So it helps you understand potential vulnerabilities in your community that you can then integrate into your planning process. So, like I mentioned, the thawing permafrost and the ice cellars. So if that is something that the community is worried about, ability to safely store food, then that is something that you could build into your planning process to say, okay, are there other alternatives, for safe community food storage? That's just one example off the top of my head, but you could do the same for water resources and the availability of safe drinking water, and ensuring that there are steps that you could plan for to make sure that safe drinking water will continue to be available even in the face of changes.
Yeah, and this is Mike. I would just add too, there are some other indicators that we didn't show here today. But, there's Arctic sea ice. There is a bit of information on Alaska. We need more, obviously. We are planning to do a permafrost indicator, and as Leslie is kind of saying, some of this information provides that foundation. It points you to the impacts that are going to be important, but then sort of that local level planning and decision making, you need some other information to pull in to help you with that. So again, this is sort of the science basis and some of the data sets that we've been able to pull together that show that long-term, fairly good line of evidence that these changes are occurring. And we're gonna continue to keep that going and get it more place-based and available at multiple scales.
Thank you. This is everyone's last chance to type in questions. We do have one more comment. I've learned a lot from this and other webinars that I've participated in. Thank you for doing them. Another thank you. Any more questions from anyone? Let's see. And while we just wait another minute or so to see if we get any more questions, just a reminder that we do have 2 more webinars. The next one on Friday about extreme weather events and climate change. It will feature Bob Rabin from NOAA, who will review known variability in extreme weather, such as excessive heat, cold waves, floods, droughts, hurricanes, severe thunderstorms, and tornadoes. And then on Monday, we have Kurt Johnson, who is National Climate Change Scientist with the U.S. Fish and Wildlife Service, and he will be talking about climate change impacts on fish and wildlife. Okay, we do have another question. Mike spoke about pollen being an indicator. How is that measured and monitored?
So the pollen, there are pollen stations out there, and so there's actually a little passive filter that's out there, and collectors will go out once a week or however frequent it is. I think it's once a week. They'll actually bring that filter into the lab, and they'll do the detection analysis on it. And so we're finding pollen, the presence of pollen later in the season or earlier in the season. Actually, not earlier in the season, mostly later in the season. And that's what provides that evidence that the pollen season is growing. And so there are actual stations out there that are measuring these things, concentrations. And so it's typically based on the presence of pollen.
Someone that sent in contact information for Michelle Davis. She's with EPA and Anchorage. And so the Alaskans who have questions about IGAP and climate change activities, feel free to contact her. I copied her phone number into the chat box. Also, Michelle and I co-host quarterly Alaska Tribal Climate Change webinars. So if you're on my climate change list and you're in Alaska, you should receive announcements about those webinars. Another question, is that something I could incorporate into ambient air monitoring? And so I think that was follow up on the pollen question.
I think there may be potential. I know they'd love to see more sites go out there. I know of a few that are discontinuing, and so that maybe that. Yeah, the National Allergy Bureau is the network, the aeroallergen network that comprises these stations, and so and manages the data. So it may be worth contacting them to see how these are established. But that's a good question. I'm not sure how one would go about initiating a site. But I think contacting the National Allergy Bureau and where this underlying data comes from would be one start.
Okay, then we have a comment and suggestion. Great presentations, although not likely to be able to quantify, cultural identity impacts for Native people is crucial for tribal communities. Perhaps these future studies could work with Swinomish and their community health indicators. Thanks.
Absolutely. The loss of cultural identity is definitely a key factor, and it is something that we mentioned in terms of community health in the report. So yeah, thank you for that comment.
Okay, I do not see any more. One last chance to type in your question before we end the webinar. Let's see. Don't see any more. So like I said before, we are posting the webinar recording and the presentations on our climate change webinars webpage. We also, during this webinar, added Leslie's and Mike's presentations in the handouts portion of the GoToWebinar panel. So hopefully you could download them from there. I want to thank everyone for joining the webinar, and also thank you very much to Leslie and Mike for giving these presentations. And hopefully I will have all of you on the next webinar. Oh, one last question. How will climate change affect future PM 2.5 levels?
Do you want to?
Yeah, as with a lot of these things, and Leslie was alluding to this in her presentation, that climate change sort of acts on top of these existing air pollution problems and PM 2.5 is a little harder to figure out than ozone in some cases, but we expect to see some increases in certain areas and some decreases in other areas. But we know that it will affect these concentrations, certainly for the worst in certain areas. Add on top of that additional wildfires and other PM sources that may be generated from these changes in climate.
Okay. Okay, with that, we are going to end the webinar. Again, thank you everyone for joining. Hope to have you on the next webinar on Friday. And thanks again to the presenters. Hope everyone has a good rest of the day. Thank you. Bye-bye.
Thanks a lot.